all evaluation and management, hip or knee-related radiology, all labs, imaging, other output services. During the triggering procedure, all of the medical, the inpatient and outpatient services from the date of the surgery to 30 days after the date of discharge. All cause readmissions, non-traumatic revisions, any complications, all follow-up evaluation and management, all of the emergency services, all of the home health and therapy, the hip, the knee radiology, any labs, imaging, or other output procedures. From 31 days to 90 days after the date of discharge, readmissions due to infections and complications, as well as hip or knee-related follow-up evaluation and management, the home health, the therapy, labs, imaging, and other output procedures. The total joint replacement episode is triggered by the surgical procedure for the total hip replacement or the total knee replacement. For a full list of these codes that are visible now, please go to the www.paymentinitiative.org website. From the main page, click on the link Episodes of Care and navigate to the TJR codes link. The episode begins 30 days prior to the date of admission for the inpatient hospitalization for the total joint replacement surgery, and it ends 60 days after the date of discharge. The principal accountable provider is the orthopedic surgeon performing the total joint replacement procedure. There are quality measures to track. It's a 30-day all-cause readmission rate, the frequency of use of the preventive treatment against the post-op DVT, and also the pulmonary embolism. The frequency of the post-op DVT/PE, and also the 30-day wound infection rate. Now we'll move to the congestive heart failure. This episode includes the inpatient facility and provider fees, professional fees for the initial hospitalization, and for all-cause readmissions, the emergency or observation care, the home health services, the durable medical equipment, and skilled nursing facility care due to the acute exacerbation of CHF, excluding services for patients with skilled nursing facility care that happened 30 days prior to the episode start. A congestive heart failure episode is triggered by inpatient admission with the primary diagnosis code for heart failure. For a full list of these codes, again, please refer to the www.paymentinitiative.org site. From the main page, click on the link Episodes of Care and navigate to the CHF codes list. The start of this episode began on the day of the inpatient stay and conclude 30 days after the date of discharge or the date of discharge for any inpatient readmission initiated within 30 days of the initial discharge. Episodes will not exceed 45 days post-discharge from the triggering admission. The principal accountable provider is the admitting hospital. A quality measure to pass includes the percent of patients with the LVSD who are prescribed the ACE inhibitor or the ARB at the hospital discharge and meet a minimum threshold of 85%. Quality measures to track is the frequency of outpatient follow-ups within 7 to 14 days after the discharge. For qualitative assessments of the LVEF, proportion of patients matching the hydrodynamic, the normal, the mild dysfunction, the moderate dysfunction, and severe dysfunction. Average quantitative injection fraction values, 30-day all-cause readmission rates, 30-day heart failure readmission rates, 30-day outpatient observation care rate, and utilization metric.